Your baby was born with club foot. It looks alarming, but the outlook today is genuinely excellent. Club foot, or CTEV, means the foot is turned inward and downward from birth. It affects roughly one or both feet. The exact cause isn't fully known. It's more common in boys and can run in families, but nothing a parent did caused it. Club foot doesn't hurt a newborn. The problem comes later, when a child tries to stand on a foot that isn't aligned. Diagnosis is usually made by a doctor examining the baby, often after being seen on a routine prenatal ultrasound scan. The worldwide standard treatment is the Ponseti method: gentle stretching, weekly casts, a small tendon procedure, then years of bracing. Each week, the surgeon gently manipulates the foot and applies a long cast from toes to thigh. Most babies need 5 to 7 casts. In most cases, a tight Achilles tendon needs a tiny release. It's a brief procedure, usually done with local anesthesia. After a final 3-week cast, the baby moves into a foot brace, worn 23 hours a day at first, then only during sleep. Bracing usually continues at night until age 4 or 5. Studies show that consistent brace use is the strongest defense against relapse. Larger surgery is uncommon today. It's reserved for late diagnoses, stiffer syndromic cases, or feet that don't fully correct with casting. The main long-term risk is recurrence, usually linked to brace difficulty. Regular follow-up visits catch this early and are easier to manage. Long-term studies show most children treated with Ponseti grow up walking, running, and playing sport, with feet that work well. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.